Welcome to our Stony Brook Comprehensive Stroke Center. Ours is the first in Suffolk County to achieve advanced comprehensive stroke certification by the Joint Commission, the nation's largest standard-setting and accrediting body in healthcare. This advanced certification indicates Stony Brook's ability to receive and treat even the most complex stroke cases around the clock and can provide a level of care that can lead to the best possible outcomes for stroke patients. You are here because your doctors are concerned that you may have had a stroke or hemorrhage in your brain. This can be a scary time for you and your family. But you should rest assured that some of the top neurologists and nurses are taking care of you, using some of the top technologies, latest research, and healing hands in the country. We know this is a stressful time in your life, and we will deliver excellent care to get you healthy again. You were probably admitted after being seen in the emergency department by a team of physicians and nurses where you were examined, had blood tests, and had a variety of imaging tests, such as CAT scans and MRIs. The treatment provided in the emergency department may sometimes feel hectic because time is critical in the treatment of sudden stroke. You may have received intravenous fluids and medications through the IV or orally. Some patients, after a sudden stroke, receive a special medication called TPA, which is a clot-busting drug to dissolve the blood clot causing the stroke. Other patients are treated with oral medications to help treat the stroke. Some patients are sent for a mechanical thrombectomy, which is a procedure that physically removes the blood clot that is causing the stroke. If you had a mechanical thrombectomy, you may go to the post-anesthesia care unit, PACU, PACU, or recovery room where you will recover. After being in the post-anesthesia care unit or emergency department, you may be admitted to the neurology floor or the neurocritical care unit. A nurse will connect you to a heart monitor and watch you closely for changes in neurological function, as well as check your vital signs. This is still a critical time in your recovery. The nurse may also perform a bedside swallow screening to make sure you are not having trouble swallowing. If you fail the screening test, you will not be allowed to eat or drink anything until you are seen by a speech therapist. The speech therapist will determine if you are able to swallow safely and may recommend a special diet. In addition, you may at times not be allowed to eat or drink before certain tests. You will also meet other members of your care team, such as nurse practitioners, physician assistants, neurology residents, and the neurology attending physician. Neurology residents are full-fledged physicians who are receiving special training in how to become neurologists. The whole team works together and makes up the stroke neurology team. In addition, social workers, case managers, physical, occupational, and speech therapists will also meet with you and your family as they develop your plan of care. Throughout your stay on neurology, you may go for a number of different tests that your neurologist ordered depending on your medical diagnosis. You may have a test called an echocardiogram or ultrasound of the heart, which can be done on the outside of the chest or internally through the mouth. You may also have ultrasound tests of your legs to look for blood clots in the veins, additional MRI tests, or more CAT scans of your brain. When you leave the floor for these tests, the nurse may travel with you. Treatments may include oral medications to control blood pressure, cholesterol, or blood sugar levels. IV medications may be used as well. Many patients are also put on blood thinners, which may be oral, intravenous, or injected directly into the skin. Over the next few days as you recover, you may be moved to a regular room, which means you are less critically ill. This is a good sign. You will continue to meet every day with your neurologist and members of your care team to transition you back home or to a rehabilitation facility if one is needed. Please remember, if you have any questions while you are here, you and your family can reach out to any of the team members to ask questions. All of us at Stony Brook Medicine wish you the best in a speedy recovery.